Assalamu alaikum. Welcome to my YouTube channel. Today we begin with a fascinating topic, Introduction to Clinical Psychology. When you hear this term, what pictures come to mind? A person laying on a couch, talking endlessly about their childhood, or maybe the idea that it only deals with crazy people. The truth is far more fascinating and far more human. Clinical psychology is the scientific study and application of psychology to understand, prevent, and treat mental health issues. It is the field that connects the science of the mind with the practice of healing. To really appreciate this field, let's break it down step by step. First, what exactly is clinical psychology? At its core, it is a branch of psychology that focuses on diagnosing, assessing, and treating emotional, mental, and behavioral disorders. That includes conditions such as depression, anxiety, trauma, and schizophrenia. But it also includes everyday struggles like stress management, relationship issues, or difficulties coping with changes. Clinical psychology is not only about illness, it is equally about promoting mental health and resilience. But how did this field come into being? Its root can be traced back to the late 19th century when psychology started merging with medicine. Early pioneers such as William Wundt were studying the human mind in laboratories, while Sigmund Freud introduced psychoanalysis, a method shaped the early image of therapy. Over time, the field expanded. With the rise of behaviorism, psychologists began using conditioning techniques to change behavior. Later, the humanistic movement emphasized empathy and personal growth, and in the modern era, evidence-based methods like cognitive behavioral therapy became the gold standard. Clinical psychology has always evolved with science adapting to the need of society. So, what do clinical psychologists actually do today? Their work can be grouped into three broad areas. The first is assessment and diagnosis. Clinical psychologists use interviews, standardized tests, and careful observations to understand a person's difficulties. The second is treatment and therapy. This includes individuals therapy, group therapy, and even family interventions. And the third is research and prevention. Clinical psychologists study patterns of mental health in order to design programs that reduce risk and promote well-being. Now, let's clear up some common myths. One myth is that clinical psychology and psychiatry are the same thing. The reality is that psychiatrists are medical doctors who can prescribe medication while clinical psychologists primarily provide therapy. Another myth is that only people with severe disorders see a psychologist. In reality, anyone dealing with stress, insomnia, grief, or major life changes may benefit from therapy. So, why is clinical psychology important in today's world? We live in an era of constant pressure, social media comparison, economic uncertainty, and rapid change. Mental health challenges are more visible and more pressing than ever. Clinical psychology helps us reduce stigma, improve quality of life, and provide support during crises such as natural disasters, war, and pandemics. Beyond treatment, it helps communities build resilience and individuals discover healthier ways to live. The future of clinical psychology is also exciting. Technology has opened door to teletherapy, digital self-help tools, and even artificial intelligence that can support mental health professionals. Emerging concerns like climate anxiety, cyberbullying, and the psychological impact of global events will shape the direction of research and therapy. Far from becoming less relevant, clinical psychology will become even more central in helping us adapt to the challenges of the modern world. To sum up, clinical psychology is not just about illness, it is about healing, growth, and prevention. When we take care of our minds, we are not just treating problems, we are unlocking potentials. We are building stronger families, healthier communities, and more resilient societies. Thank you for joining me on the thoughtful journey. Together, we will keep exploring the mind and its mysteries.